So we hear a lot about diabetes, Dr. Armato. How would someone be at risk and how would they know they might even have diabetes?
So when patients first come into the office, one of the issues that we address is, what really is my risk of developing diabetes? And in part you can tell just by looking at someone sometimes. So they may have obesity and particularly visceral fat, which is that central fat around the abdomen. But there are a lot of other risk factors that you need to consider. Is there a family history of diabetes? Do they have other clues in their laboratory studies, like a mild elevation of blood sugar over 100, or high triglycerides, which are part of the cholesterol profile, or low levels of good cholesterol? And there's some medical conditions that also might heighten your uncertainty as to whether or not diabetes might be present or prediabetes. So those are clues that you need to look at. And if those are present, we need to really look at more advanced testing to precisely identify where a person is on that path towards diabetes.
So a patient comes in your office and they are diagnosed with diabetes. What do you suggest? Are there things they can be doing holistically to help prevent, the diabetes or to keep it managed better?
Well, if they already have diabetes and that diagnosis is made, the reality is that process has been going on for many years. So you're kind of later in the game by the time the diagnosis is first made. It's already past the tipping point where the body's trying to still compensate for your problems. So I think if you have diabetes as a diagnosis, you need to realize you need to be very serious about executing on diet and exercise, working together with your doctor to restore normal chemistry in your body, because this process has already got a head of steam, and you need to really be serious about controlling it.
So what's your advice to people to help prevent diabetes so they don't get in that stage?
I think that's a great question. Prevention of diabetes, prevention in everything really has to be our focus. So the best approach is to execute the best you can within the confines of life, to remain trim, to exercise as close to every day as you can, to have a normal sleep pattern. That can change your chemistry. And with these lifestyle changes, we may be able to prevent over 60% of diabetes from developing. Now, we've known that a long time, and it's hard to do that. So diabetes still continues to progress. Another important thing to know is that recent studies demonstrate that the use of medicine in conjunction with diet and exercise can prevent over 80% of diabetes in patients who are at risk. I think that's an important message too.
That's good. So Dr. Armato, if someone has diabetes, that's a problem for many other health conditions. It can really impact your health in many ways. What kind of complications can be resulting from diabetes?
Yeah, I think that's a great question, and all of us know about patients who have diabetes and many of the risks they have and challenges they have with their health. I think the really interesting part is that many of those consequences actually begin in pre-diabetes. So even before someone has diabetes, we already see an increased risk of heart attacks. There's a 50% increased risk of heart attack in pre-diabetic patients. By the time you have diabetes, there's a 200% increased risk to those individuals. But we also see increased risks of Alzheimer's disease. We see risks of heart disease where the heart as a pump begins to lose its effectiveness. We see changes in the back of the eye that can lead to vision problems. We see kidney changes. All of these things actually begin in pre-diabetes. It's kind of a strange circumstance where you're having consequences even though you don't have a disease yet. But that's the way the body works, and it really speaks to the importance of identifying things earlier so that we can be better at prevention in all of these areas.
So what should people do to help to understand better their risk for diabetes? Are there tests, things they should be doing on a regular basis?
Yes, and so the first thing that we do is really look at the overall probability that there's a problem. So if you have a family history, or if you're obese, especially that central fat that we talked about, if you have high blood pressure or early heart disease, people with early heart disease much more likely to have a problem with their chemistry of sugar and insulin. If you have sleep apnea or fatty liver or other disease states that are associated with an increased risk, there are advanced tests at Providence Little Company of Mary that can identify more precisely where you are on that path towards developing diabetes. And then we know, is this a big problem or a little problem? And we get a clue as to how it needs to be approached.
Dr. Armato, I understand blood glucose testing is only one way to diagnose diabetes, but there's more sophisticated opportunities that you're engaged in. Can you tell us about those more sophisticated testing for diabetes?
Yeah, so blood glucose and measuring blood glucose is one way of trying to pick up people at risk. So if your blood sugar is over 100 in the morning, that's not quite right. And there are some conventional tests that help us, like a standard glucose tolerance test, and that measures the blood sugar's response in your system after you drink a defined amount of sugar, okay? But at Providence Little Company Mary, we have a specialized kind of test that, in addition to measuring glucose levels, also measures insulin levels and some other elements that allow us to be much more precise at knowing how your body handles sugar and insulin and where you are on that process. Is your body healthy in terms of its chemistry, or is it moving in a direction that might lead to disease? And with that knowledge, we can build a better preventive strategy.
Dr. Armato, when someone walks into your office, a man walks into your office just and wants to be healthier and prevent diabetes, what do you tell them?
Okay, when someone comes in and we're interested in prevention, there are three main points. Number one, you need to execute well with regard to diet and exercise. It's your responsibility. You have to take care of yourself and do your part. That's number one. The number two is, if there are risks that you might be developing diabetes, the ones that we talked about, family history or minor lab abnormalities, we need to do more precise testing to characterize where you are. And number three, if natural approaches, diet and exercise strategies, don't restore normal chemistry, then we need to think about bringing nature and science together, medicines and lifestyle, to improve our attempts at prevention.
So what about high blood pressure? Is that something that people should worry about? Is that indicated for diabetes or overall health? What do you suggest there, doctor?
So is blood pressure part of this picture? Clearly the changes in chemistry that are related to diabetes increase the risk of blood pressure, and they're related. In fact, the three things, high blood pressure, heart disease, and diabetes are kind of like the Rat Pack of physiology. It's sort of like Frank Sinatra and Dean Martin. If you have those there, you better look for Sammy Davis, because they tend to hang out together. So we have to be more aware when any of these are present that the other two might also be in play.
So men are reluctant to often go to the doctor. What advice would you give to men about not visiting the doctor or having regular checkups?
Okay, so here's the deal. Men by nature don't want to go to the doctor, and they wait for symptoms, and I think that's a real mistake. The body is designed to keep you going and to compensate even when things are out of whack in your body. So if you wait for a symptom, you're waiting until that tipping point has already been reached. It's like the body's already tapped out at that point. And you've lost your attempt at prevention. And sometimes that first event is a really bad one. It could be a heart attack or a stroke or the diagnosis of diabetes. Or you're just an old geezer now, because your system has kind of worn down and been burdened by this process that's gone on over time. So my advice is, bite the bullet, get in there, just make sure your physiology is headed in the right direction. It's like checking your GPS. Am I headed in the right direction? And if you are, fantastic, go about your business. And if you're not, take the bull by the horns and get things in balance. I'm a big believer in prevention, and we have the tools that allow us to do that now.